Welcome to another episode of Living with FASD, an educational and human interest show for those affected by prenatal exposure to alcohol, their loved ones, and anyone else wanting to learn more about fetal alcohol spectrum disorders. I'm your host, Patti Kasper, your FASD coach, and I am welcoming back to the mic today Dr. Jerrod Brown, who is a recurring guest on this program. Once again, I hope you have a notebook and pen handy because there's tons of notes to take from our conversation today. And the topic today is alexithymia. So, Jerrod, welcome back to the program. So glad to
Thank you,
have you
Patty.
as always. Could you begin by defining for us what alexithymia is?
Yeah, thanks, Patty, for having me back. So, probably a term that a lot of people maybe have not heard of, but once you understand it, you probably have dealt with it or you see it all the time. And folks you interact with, it's very common among just really everyday situations. We'll talk about it, but it's not necessarily a disorder. It's in the research literature, the best way to put it, it's emotional blindness. The person that has true alexithymia typically has difficulty around like emotionality, processing emotions, labeling, naming them, making sense of emotions. Like anything we talk about, it probably falls on a spectrum. Some people probably are more severe than others. I've dealt with alexithymia. I know we all have. If we ever dealt with burnout, if you're
Mhm.
dealing with high levels of stress, it's very common amongst just people in general. But certain population groups are much more likely to be dealing with this. So it's a deficit, it's been referred to in the literature,
Mhm.
a personality trait in some cases. It's been referred to as a multi-personality construct. It's been defined as having no words for feelings.
Mhm.
Sometimes it's talked about as a psychological impairment, a subclinical trait, depending on what research literature you look at. If you look at the psychological literature versus the medical, sometimes it's been called a disorder of emotional cognition. So it's really all over the map. But
Mhm.
emotional unawareness, social attachment difficulties are common among folks with alexithymia because it can look like empathy deficits in a lot of cases.
Mhm.
People are surprised to learn this too. If people with true alexithymia typically have a limited imagination and poor self-awareness, so they have a hard time going inward, like introspective awareness, things of that nature, and they often think more concretely. So when you talk to
Mhm.
somebody who's dealing with a high level of alexithymia, the way they communicate, it could come off as cold, callous, aloof. They lack perspective taking, and they're just very matter of fact. So maybe if you're talking about something that's really sad or difficult, they may just come off as robotic in some cases and just come off as very matter of fact, which could rub the other person the wrong way,
Yeah, I
thinking this
imagine
person could,
that could cause a lot of challenges in relationships and cause a lot of ruptures.
yeah. I've given a lot of talks on this from different angles, and I've written a couple articles, and I literally get emails on one of the articles I wrote. It was
Mhm.
more geared toward counseling professionals. I get emails all the time from people who have read that article from all over the world. And the common email goes like this. I read the article. I think I know what my spouse is dealing with now. They always come off as very flat. I'm always trying to share my emotions.
Mhm.
It's usually a wife emailing me about a husband, to be honest with you. And they always, what do I do about it? My husband always comes off as flat.
Mhm.
I ask them, do you not feel emotions when I bring this up? And they say no, which there is some evidence that shows that a high degree of alexithymia in a marriage can increase conflict and divorce in some cases. So
Mhm.
really fascinating topic, and a couple things just to give your audience just a foundation. In the general population, most of the research has found about 6 to 10% of people in the general population probably deal with alexithymia. when we start looking toward clinical populations,
Mhm.
severe mental health, chronic medical health conditions, that number goes up to maybe 50%. And
Wow.
if we look at drug and alcohol treatment programs, you will find lots of studies on drug and alcohol abuse. Statistics put it at between 50 to 65% of people with a
Mm,
drug or alcohol problem are
mhm.
dealing with traits of alexithymia.
Well, and that kinda makes sense
Yep.
because so oftentimes substances are used to self-medicate discomfort.
Yep, absolutely.
And so if once it's medicated, there's really no need to continue trying to name it and claim it and process it, right? But you teased us with I get tons of emails with this. What, pray tell, do you tell these people in return?
Well, what do we do about it, basically?
What do I do with my husband? Right? What
It's a tricky thing, but here, the best thing I can recommend is become aware of this topic.
Mhm,
If you are aware of it and you can define what it is, then you have more compassion,
mhm.
more understanding, more patience, and then you become less reactive in those situations because I think
Okay.
high reactivity in these situations with someone that has alexithymia, they probably still feel emotions,
Mhm.
but all those emotions go into their body.
Okay.
And there are a multitude of studies that show that people with high alexithymia have more stomach issues, more headaches, more
Mhm.
chest pain, more blood sugar dysregulation, obesity, stress eating, smoking, the
A
list goes
lot
on
of
because
psychosomatic stuff.
without a doubt, and in
Yeah.
extreme circumstances, this is an extreme end of the spectrum. The person with alexithymia has all this emotion, but they
Mhm,
can't get it out for some reason.
mhm.
And there's organic causes for alexithymia and situational causes, I should say too. So organic causes could be prenatal alcohol exposure,
Yeah.
traumatic brain injury. Situational factors could be grief and loss,
Mhm,
professional burnout, things like that.
mhm.
So worst case scenario would be all this emotion builds up. The person doesn't have a clue what's going on. Their heart starts pounding, they're sweating, their chest hurts. They think they're having a heart attack.
Yeah.
They call 911, they go to the emergency room, and I use this analogy all the time in my talks, and the doctors, the nurses in the emergency room run all the tests. They can't find a thing wrong with the person.
Yeah.
That could be an extreme case of alexithymia. There's plenty of literature that also supports the fact that alexithymia is a potential risk factor for self-interest behaviors, for suicide, for mental health issues, for violent behavior, which makes sense. Because again, all that emotion goes into the body, it's locked in there, and it's
Mhm.
wreaking havoc on a physiological and a
Yeah.
neurochemical and a neuropathophysiological level.
And
So
it has to
sometimes they're cutting to
explode.
get that energy out, and they
Yeah.
just
Yeah.
so it presents in a lot of ways.
That kinda reminds me, that takes me back to the late '80s when I was working chemical dependency, drug and alcohol abuse. I would talk about, attempts to repress feelings like you remember when you're a kid in a pool and you have the balls to play with and you try and hold it down. Well, the deeper underwater you try and hold it, the bigger the splash when it comes out, right? And
Yeah,
if you
that's a
try
great
and sit
analogy.
on it,
Yeah,
as so many of us do, try and stuff those feelings as far down as we can, then that splash is life coming undone, right?
absolutely.
Yeah.
And for someone with true alexithymia, they may not know they're doing that. So
Mhm.
it can look like a emotional suppression denial, but
Mhm.
there's probably no conscious awareness. Maybe there is in some cases, but usually the literature says they don't realize they're doing it. And the causes are many and varied, but if you look at it through a trauma lens, numerous studies show that people with extensive trauma in their histories
Mhm.
are much more likely to be dealing with alexithymia. So
Yeah.
maybe early on in life, the child was exposed to so much abuse and chaos in the home. There's no conscious awareness now as an adult or teenager that when things get tough, they
Yeah.
just automatically, those
Shut it
emotions go
off.
into the body and they shut them
Yeah.
down.
Yeah. Yeah.
It comes out as skin problems too. You'll find literature on people with alexithymia have more skin issues as well because all the energy comes out in the body and it just again wreaks havoc on the hormones, the neurotransmitters,
Okay.
our circuitry in our
And our
body.
skin is our largest organ.
Yeah, so it's really fascinating
That is
topic.
fascinating.
It is definitely and needless to say, I think hopefully now if the audience has heard this, alexithymia is also a risk factor for loneliness because again,
Mm.
someone that has a lot of
Mhm.
alexithymia traits, they may rub people the wrong way. It may be hard to keep friends. It
Yeah.
may lead to breakdowns working in groups or a classroom or even on the job. So
Yeah.
loneliness goes up.
Yeah.
Loneliness is a threat to our health as well.
Yeah.
So this is a real threat to human health,
Yeah.
cognitive health, physical, emotional, behavioral.
Yeah. Yeah. Um, so how would you say that those who are high in alexithymia, how are they perceived by others?
Well, it could come off in many ways. So I mentioned briefly like empathy problems in some
Mhm.
cases.
Mhm.
The person could come off as being very cold and callous.
Mhm.
There's some literature that it has indicated that obviously alexithymia can contribute to negative like emotionality, negative affect, but it could come off as like neurotic symptoms in some cases.
Mhm.
Poor social exchanges or poor one-on-one exchanges where again it could lead to breakdowns in that relationship. Self-control deficits without a doubt, because if all that energy goes into the body and the person, let's say they have FASD and they have very poor coping skills and executive dysfunction, that could be a recipe for self-control deficits,
Mhm.
risk-taking behaviors, stress eating, getting into fights. It
Mhm.
could, in some cases, be a factor for humor deficits. So people with a high degree of alexithymia
Can't take a joke.
well, maybe they're delivering a joke too, and it's like
Yeah.
you're delivering a joke to someone who just lost a loved one and you're trying to be funny, and they're
Yeah.
not connecting the dots
Yeah.
there.
Yeah.
So that could come off as higher levels of irritability,
Mhm.
rumination. So it really can present in so many ways. But just think about this. Somebody with alexithymia, how are emotions to that person? They can be confusing,
Mhm.
they can be scary, they could be overwhelming, they could be a mystery in some cases. So you, Patty, sharing how you feel with someone who has alexithymia and you're really opening your heart to that person. That person hears that, all those feelings could just be a mystery.
Yeah.
It's not clicking,
Yeah.
which then you could get confused by that person's reaction or even get frustrated and stuff.
Mhm.
So
Mhm. I'm wondering too if about the correlation perhaps with people who are deemed to be narcissists. How many of them might, what appears to be that self-centered focus might be alexithymia.
could be both.
Mhm.
It could be one of it's tough to know, but there are studies that have looked at those kind of behavioral kinds of personalities. There are plenty of studies too that have looked at like personality disorders in general.
Mhm.
And alexithymia traits have been noted to be higher among people with personality disorders. That could be antisocial, could be narcissistic personality disorder, borderline, but
Mhm.
just know the more trauma the person has had in their life, the
Yeah.
more attachment disruptions, the more head
Yeah.
injuries, the more stress they're dealing with, the more burnout, these symptoms go up.
Yeah.
And it's
That
probably even more prevalent in people with those organic based brain impairments. Now, I
yeah.
know we're talking about FASD. There's virtually little empirical based literature on fetal alcohol spectrum disorder and alexithymia. You'll find a
Mhm.
couple articles that mention the term here and there, but if you break apart the term and look at the symptoms and the emotionality, almost every case I've ever consulted on where someone has FASD, they're dealing at least with traits of this.
Mhm.
Again, how prevalent is it? I don't know. But what I can say, if you look at the autism literature, it says about 50% of people on the autism spectrum do have alexithymia. So
Mhm.
how does that relate to FASD? Don't know, but definitely an
I
area for more study.
Yeah, I would not be surprised if it turns out to be roughly equivalent to what we see with ASD.
Yep. It's
Yeah.
it's elevated in all kinds of clinical,
Mhm.
psychiatric,
Mhm.
neurodegenerative disorders. Several studies have looked at neurodegenerative disorders within this context,
Mhm.
trauma and stress related disorders, and
Yeah.
lots of medical comorbidities as well.
Well, yeah, and like I've said it to you before, I see that my mother really struggles with this, and with her, it's dementia.
Yeah, yeah,
Yeah,
definitely.
yeah.
That could be more that organic base to this as well.
So it does sound like, we have no idea what the prevalence is because there's just the dearth of research, specifically targeting FASD. But it also sounds like it is more of a symptom of someone's FASD rather than a diagnosis that a parent can go out and run out and get a diagnosis for their kid.
There are screening tools out there, but how frequently are they used in practice?
Hmm.
Not a lot. If you were to go ask the therapist who's working with your child, tell me about alexithymia. I
Hmm.
can't prove this, but just my experience training folks in that realm, most of the time they never even heard of that topic. But once you
Hmm.
explain it to them and they
They can
understand the
relate.
symptomology, oh yeah, I see that all the
Yeah.
time.
Yeah. Speaking of which, screening tools,
Yeah.
one of the comments that came when I put out a post about 2 weeks ago that I was getting ready to talk with you about this topic, um, someone had sent in to me a screening quiz. Um, these internet tools that you find, um, that is like, are you emotionally blind, right? Find out
Yeah.
about, do you have alexithymia? How useful do you think that might be for someone? Would you recommend that I put the link to that in the show notes, for example?
Probably not. Just from my researcher lens, I mean, it's a good conversational starter, but there's so many screening tools out in the literature on alexithymia that are empirically based and
Hmm.
studied. So those are the ones that hold the science behind it. The Toronto Alexithymia Scale is the most widely used tool in the research. It's called the Toronto Alexithymia Scale. I believe it's a 20-item inventory, and it asks different questions about like describing feelings, identifying feelings, things
Hmm.
of that nature. But again, it's not like a parent would be using that tool, be a professional
Yeah.
who's had training and is qualified to use that tool to maybe do the observation. There's a
Hmm.
lot of tools out there besides that. That's the most heavily cited one. Some of the tools are for kids, some are for adults, some are observation scales, some
Hmm.
are asking parents their opinion, and some are directly with the client. So finding professionals who understand this topic is probably the way to go. But
Okay.
even just educating yourself about this is a good starting point because in the research literature too, one of the primary interventions, it says psychoeducation.
Hmm.
If you can learn about this, you're in a much better position to be patient and kind
Hmm.
when you have a child or a teenager or an adult with alexithymia. But interestingly too, there are studies that show that if you teach somebody who has alexithymia that they have alexithymia, that actually reduces symptoms of alexithymia. So just creating more self-awareness.
Hmm.
And there's a
Hmm.
lot of ways to create more self-awareness around feelings besides just talking about it. But we can talk about that today too, if you'd like.
I would love to. because that's one of the other questions another listener or viewer had is, beyond naming an emotion
Mhm.
that my child might be struggling with, that seems like a first step. How can how can I support my son, for example, to develop awareness of feeling states?
Yep. In the research literature, if we look at this through a treatment lens, the research talks about first assessing for it, screening for it, knowing if the person has this or where they
Hmm.
fall kind of on the spectrum, collect relevant information from collateral sources when appropriate. So maybe the person presents differently to mom and dad than they do to a school teacher, just
Hmm.
learning from everyone who's interacted with this person, kind of how that person presents.
Yeah, because
And
we
then
present differently in different environments.
absolutely. How does a person present around animals versus
Yeah,
people or
yeah.
adults versus kids? So just getting that data, maybe, and if we're talking FASD, I think getting a good neuropsych test too, because
Hmm.
finding out what domains of functioning are working, what aren't, looking at executive function, all these things. The next step, if you look at it through a treatment lens, really starting to explore that person's emotional states. So when
Hmm.
they get afraid, what happens? What
Hmm.
do they feel?
Hmm.
When they're happy, when they're overwhelmed,
Hmm.
do they have emotions? How do they explain those emotions through body sensations? So just getting a good feel that maybe this person, when they're really overwhelmed, they don't say anything, but they start complaining that their head really hurts or their
Hmm.
stomach hurts. Just getting a feel for the
Yeah.
body symptoms, things like that. They also talk about really forming a good therapeutic alliance with a counselor therapist, because
Hmm.
here's what happens too, is that unfortunately, a lot of counselors, therapists haven't had training in this. And the research says if the therapist doesn't have awareness of alexithymia, that could lead to a breakdown in the therapeutic relationship because the therapist jumps to the conclusion the client doesn't want to be there and is not ever willing to answer questions about emotions.
Hmm.
If you can teach the therapist that maybe the client can't answer questions about emotions,
Yeah.
then the treatment plan changes.
Radically. Yeah. Yeah.
So then if once we move through that phase, a lot of things we can do. And I'll point out one right now, but maybe we can go back to some other modalities in a minute. But people with alexithymia a lot of times have difficulty with self-awareness and even interoceptive awareness, just being
Hmm.
aware of how their emotions affect body sensations. So there's a whole list of things to be aware of.
Excuse me.
Oh, no problem.
A tickle.
Mindfulness-based strategies could be an effective intervention. Yoga, if the person is working with a trained yoga specialist, getting clearance from the doctor.
Hmm.
Exercise can be very, very helpful, just getting movement, because what better way to help us connect to our emotions and our body sensations than getting more movement, getting breathing going. Some studies have also pointed to the fact that being in group therapy can be very helpful.
Hmm.
But the kicker is the therapist has to understand this topic.
Hmm.
And there is
Yeah.
some literature out there that therapists who understand this topic and just provide the education to the clients in the whole group, that can bring down the level of alexithymia.
Yeah.
Journaling can be very, very helpful. And getting involved in like creative arts. It talks
Hmm.
a lot about not just sitting there talking about the feelings, dance interventions, play
Hmm.
therapy, music therapy,
Art
creative
therapy.
dramatics, things like
Hmm.
that can be
Yeah.
more helpful, kind of unlocking all that emotion that they
Yeah.
probably so desperately want to get out, but it's so
Yeah.
locked in there.
Yeah. Well, all those techniques that I had tossed out art therapy, but all the examples you just provided have the element of movement, right?
Yes, absolutely. Yes.
Which brings out that getting things out, right? So,
Yep.
and not just in a mind kind of way.
Cannot
Yeah.
agree more.
Yeah.
If we were to go a
Excellent.
little bit deeper in the weeds here, I'll give you a few more things in this
Yeah.
literature. People be shocked to hear this. You've maybe never heard the term, but there have been literally thousands of studies written on alexithymia since the mid 1970s.
Hmm.
It's crazy how many studies have been done on this. In all my schooling I've had, even in my doctorate degree, this was never talked about, which is
Yeah.
surprising because half of like mental health populations, as many as 65% of people with drug and
Hmm.
alcohol problems have this. So
Hmm. Hmm.
half the people the clients see probably are dealing with this.
Yeah. Well, and
So
that's that the baffling response to that really is parallels the response we have in like child welfare or child mental health,
yeah,
of people that don't understand FASD
yeah.
because the prevalence is so high, right? Particularly in child welfare. Uh,
the
Buddy,
the 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 likelihood of children in foster care, the child welfare arena that are dealing with this are probably through the roof, just because of the nature of the attachment problems and the extensive trauma histories. And then on top of that,
I'm
the in
trying to
utero
untangle my
experiences.
dog from the microphone cord.
Okay.
Buddy, what are you doing? Oh, goofball. Sorry about that.
Okay. Laughter can get the
He
emotions out.
he tried to leave and my mic went shoo. Oh, now I have a dog on each side. Mom.
Getting
So,
animals involved in this equation, helpful intervention.
I bet it is. I
It
bet it is
absolutely
because
is.
their
Absolutely.
animals are so much safer, right?
Yes,
Yeah, because they're
definitely.
non-judgmental.
What
Yeah.
better way to build empathy for
Yeah.
someone that's had a tough go at it? Yeah, get around
Yeah.
animals, equine therapy.
Yeah. Yeah.
So there's a multitude of interventions that have actually been talked about in the alexithymia literature, and DBT is one of them. There's a good handful of studies that show that dialectical behavioral
Mhm.
therapy may be a helpful intervention to bring down alexithymia traits. And we know DBT is for folks with emotional intensity problems
So
and all kinds of,
can you summarize that for our listeners or viewers? I know our time is winding down. You
yeah,
said we've got 6 minutes left for when you said we needed to cap this off. I've
sure.
been I've been trying to stay cognizant of that
Yeah,
to honor your time. But
yeah.
for our viewers, our listeners, what is DBT and what makes it different from other kinds of cognitive approaches?
Well, it's structured, it's evidence-based. I think a lot of people always think it's for folks with borderline personality disorder, which it is, but it's been extended to work with all kinds of populations. It teaches self-regulation. There's components of mindfulness in there and
Mhm.
helping people be more aware of their triggers and emotional mood states and helping them learn skills to
Okay.
get into their window of tolerance. There's all kinds of practitioners that are trained in DBT around the country. Now, I don't know a lot of people that have DBT training on top of alexithymia, but I
Mhm.
think they should, because if you're working with folks with high emotional intensity problems, half your clients or more are probably dealing with alexithymia if you believe the literature on this.
Mhm. Mhm.
Music therapy is absolutely supported in this literature. I've seen this play out firsthand in cases I've consulted on. I hear this all the time. When I feel the most emotion is when I'm listening to music.
Mhm.
I hear
Mhm.
that all the time. So music therapy, working with a trained music therapist could be very, very helpful.
Yeah, and that really is no surprise because if music weren't so capable of eliciting emotion in people, there wouldn't be soundtracks in movies.
That is very true. Absolutely. It pulls at our
Yeah.
heartstrings without a
Yeah.
doubt.
Yeah, it leads and guides, right?
Mhm.
I mean, even when I was a little kid, if I heard suspenseful music, I just left. I left.
So it
Yeah.
can absolutely trigger wonderful things in people
Mhm.
and bring back people to a trauma situation instantly too.
Mhm.
So
Yeah.
you got to be careful
Yeah.
too. Yeah, depending on the music and the setting, of course.
So are there some emotions that are harder than others to, to bring into awareness or to find words for?
It really it's so hard to say. It probably depends on each individual.
Okay.
Cultural factors play into this,
Mhm.
developmental
Mhm.
functioning capabilities,
Mhm.
your family of origin. Did you only learn about painful emotions? Did you only learn how to react when things were terrible and you grew up
Mhm.
in a home where you didn't learn a lot of feelings around joy and happiness? So
Mhm.
it really probably is individualized to that person, their unique experiences, probably some genetic and prenatal factors and even some
Mhm.
intergenerational factors to take into account.
This is actually triggering some other thoughts for me. For instance, we have the societal norms of boys don't cry and it's not okay for girls to be angry, which is why we oftentimes see males who are very sad about something or very afraid about something, or they out comes their anger
Yeah.
instead
Yeah.
of those softer, more vulnerable emotions.
Yeah.
Likewise, when girls and women are really ticked off, and they shut it down into tears. So we have that going on in prior generations, and yet in today's generation, it's so the woke generation is, you know, we can be vulnerable. It's our truth, it's our emotions, and everyone's out there and up front and center. So we have these cultural shifts, and I'm really curious about how that might interplay with alexithymia.
It'll be fascinating to see in the decades to come, but if you grew up in a home and you were given permission to express your emotions, name them, label
Mhm.
them, your parents modeled healthy emotional regulation and management, you're probably going to grow up and be better off with handling difficult,
Mhm.
confusing, scary,
Mhm.
overwhelming emotions. Versus again, why do so many kids with high levels of trauma deal with this?
Yeah.
They were in an environment where maybe emotions were suppressed.
Yeah.
They were told just to suck it up. Anytime they went to mom and dad and brought up something scary or painful, they were minimized.
Yeah.
Depending on, is it a home where there's a lot of attunement and attachment and empathy or parental warmth, or is it a home where the parent's unpredictable? The child's
Mhm.
put in a role reversal kind of manner where the child now has to be the parent, taking care of the parent's emotion.
Yeah.
Were they growing up in a home observing domestic violence or
Yeah.
severe mental health?
Yeah.
So the
I was
adverse
going to
childhood
raise that.
experiences, yeah, it all plays into this discussion.
Yeah, I was gonna raise that example of,
Yeah.
when a child is brought up in a chaotic environment where the person who is supposed to be their safety net is their
Yeah.
abuser, then
Betrayal trauma and complex developmental trauma.
yeah,
And
yeah.
what perfect storm for someone to have these issues as they get older if they
Mhm.
were brought up in a home and 1 minute the parent was the most nicest, calmest, regulated parent. The
Mhm.
next day, the parent is yelling and screaming and unpredictable. It's that roller coaster ride
Yeah. Yeah.
where now they can't trust their emotions in their parents.
Yeah.
And now, as they get older, they've suppressed them. Maybe it's through drugs, alcohol,
Yeah.
food, and it comes out as body-based complaints.
Yeah. And I think we have those intergenerational effects too, because um, as we are those children, get older and then we begin to parent, we're starting at a place without the necessary skill set
Yeah. I
to
mean,
to
did
be
we
able to
learn
teach and
feelings
coach our
words?
kids. Yeah.
I'll throw several things at your audience to think about when you think about that from an early childhood lens. Attachment theory, obviously, top of the list, but then
Mhm.
I would recommend Googling joint attention, social referencing, mind-mindedness, mentalization, theory of mind. All of these things play into this, and we could explore any of those topics at another point, but those
Yeah,
are kind of the big building blocks
yeah.
for child developmental outcomes as they get older.
And I think we're gonna have to leave it there, that we're gonna tease this out to another episode because you, my friend, are out of time. So thank you everyone for coming back for another episode with Dr. Jerrod Brown. Always so pleased to have him as my guest on Living with FASD. Please send emails with questions, comments, examples of this playing out in your family to Living with FASD podcast at gmail.com. If you have questions for Dr. Brown, please put them in an email and we will address them when he comes back in another 6 weeks. But until then, thank you for tuning in and have a great week. And we'll see you next time on Living with FASD. Take care, everyone.
Bye, everyone.